Grayson. Hi.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Darshaw, who holds a PhD in integrative medicine, a doctorate in OT, specializing in neurology, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, registered herbalist with the American Herbalist Guild, and author. Her naturopathic journey began when her son, who was diagnosed with autism, developed a series of traumatic, life-threatening chronic health issues. For over a decade, she's honed her skills to combine the ancient Ayurvedic healing practices with Western herbal medicine that has helped patients in over 50 countries and recovered her son, who is on his own journey towards becoming a physician. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Darshaw.
Hello and welcome back to the BioNexus Health Autism Uprooted podcast educational series, where we talk to parents of children on the spectrum and we emphasize herbal and naturopathic medicine. We learn what brought them to go down this route, and we hope to gain insights on their journey and how the journey has been. Today, I am very happy to welcome an amazing mom who is also a registered nurse.
Thank you, Dr. Joshua, for having me. I'm very excited to talk about everything that's involving my son, Grayson. So looking forward to it.
Awesome. So tell me, what brought you to wanting to try herbal medicine, natural medicine? You know, you heard about me from someone. What brought you to herbal medicine?
So growing up, my family has always been very holistic, if you will. We believed in a lot of herbs for certain kind of illnesses like bronchitis or, simple colds and things like that. So I always was brought up that way. So, and obviously, my background, that kind of veered me a little bit away, but coming to the realization of what's happening to my son and no longer being in denial, I decided to go back to my roots of, what has kept me and my family healthy for basically all these years. And I figured, God made herbs and God made everything for our bodies to heal and, food for us to eat and all these nice herbs. So I was like, you know what, let's give this a try, so, and here we are. And so far, we've been on this journey for a long time, and this has been the one thing that has given us this much progress for our son in such a short amount of time. So we're on the right path.
So how old is your son, and at what age was he diagnosed as being on the spectrum?
So my son right now, he's 3 years old, almost 3.5. He was diagnosed a little over 6 months ago. Mainly because, the pandemic happened and we had to reschedule that appointment. And then before that, we had my daughter was being born, so we had to reschedule that. So he would have been diagnosed a little bit sooner. But because of everything that's happened, I knew he was having issues with autism, like behaviors, ever since he was about maybe 10, 11, 12 months. And then I stopped being in denial around 18 months. The day he turned 18 months was when I said, let's dive in head first. Let's go,
Right. So. You mentioned something really beautiful about, growing up with a naturopathic incline towards your health. If I may, what is your cultural background, if you wouldn't mind sharing?
I'm Dominican.
Okay, wonderful. So as in from the Dominican Republic?
Yes, Dominican Republic, yes.
That's wonderful. Cyndi, one of the things that has been really inspirational to me as well is being able to help people from so many different countries. And what inspires me is listening to stories and cultural nuances from, I think now we are more than 55 countries around the world, and honestly, you must have seen that as well. But mothers are mothers.
Yeah.
It doesn't matter, what cultural background you are from, what country you're from, right? The mother and child bond is the same.
Yeah, it's unmistakable. It's unbreakable.
Yes, yes. So, can you tell me what kind of symptoms, what kind of behavioral issues and symptoms you were experiencing with your son? And what did you try? What worked? What didn't work before you started herbal medicine?
Oh goodness. Okay, I'll try not to go too long. But
Go ahead, take your time, please.
so the type of things that I started noticing with Grayson when he was 10, 11 months is that he kind of just stopped progressing. Like he was, he sat up, he started, babbling, he was laughing, he was doing all the appropriate things, but like around the 10, 11th month marker, he wouldn't point, he wasn't clapping. And, at the time I was like, maybe some kids just develop a little bit later. So let me give him some time and let me start socializing him because he had a lot of severe anxiety. So that actually started getting a little bit worse. So that as he started reaching like a year old to 13, 14, 15 months, he wasn't making any progress. Like he started losing his engagement a little bit with me. He stopped laughing as much. Like he was very like almost sedated, if you will. Like he was very calm. Like he didn't want to play. He was like, I could just leave him on the couch and he would just be fine, just kind of like vegging out and not doing much. And then I was like, something's going on with him. I don't know what it is. I talked to this pediatrician, and of course, like many pediatricians, they say, oh, he's fine. He just came over a few viral infections. He had croup really bad. So she was like, that's a setback for him. So a lot of kids in her experience have some regressions during viral exposures, and they come back after some time, just give them some time. And, that mom instinct of me, I was like, no, something's wrong, this isn't normal. And that's when I started talking to my grandmother a lot. I started talking to my mother a lot, like what are some things that I can do for him, and the juicing, the certain kinds of foods and little tinctures that my grandmother used to do for us when we used to be sick, I was doing for him. And I think little things happening with him, and I was like, okay, maybe he isn't, what I thought he was. Maybe he wasn't autistic. Maybe he was just a little deprived of nutrients and things like that. And then a lot more things started happening. Actually, he started to walking. He started flapping with his arms, and I was like, okay, you know what? Let me do other things with him because this isn't working for him. So we started our biomedical approach the day he turned 18 months, because I thought to myself, me and my husband both looked at a lot of this information, and it seemed to help a lot of people. So we're like, you know what, let's dive head first. I stopped breastfeeding him that same exact day as well. Which oddly enough, that one day I remember I take notes in my journal, and he stopped to walking that one day that I took him off of breast milk, and I started giving him his purees of I took him off of meat too, and he stopped to walking, and he wasn't flapping as much that one day. And I tried to recreate everything that I did that one day, and it just wasn't happening. And then we started him on all these supplements and everything with biomedical that we were doing for him. And it seemed like he was getting worse. Like it seemed like his symptoms were intensifying, like his arm flapping, his isolation, his toe walking, his sleeplessness. Before, he never really had a terrible issue sleeping, but he, like every so often, like maybe out of 7 days, it would be like 2 nights that he would have trouble. Like he would wake up and like screaming. And I just assumed, from my grandmother telling me, oh, maybe he's having a bad dream. It's okay, but now looking back, I realized it's probably excruciating stomach pains that he was having, but that got worse when we started diving further into biomedical. He's every night, it was every night. And I was like, oh my goodness. And, they tell you stick through it. You have to stick through it. Kids get way worse before they get better. Stick through it. And we tried, amongst all the feelings that me and my husband were feeling, we were like, we shouldn't. But we were like, let's try. And he was getting worse. All the babbling that he was doing wasn't there. His toe walking, his arm flapping was worse. He wasn't socializing. He was crying and whining so much more. I couldn't really do much with him. And then we started doing HBOT, and that actually helped him a lot. That calmed him down. That made him focus a little bit more. that made him kind of like smile again and start laughing again, which was huge for me because he was such a sweet, happy little boy. And then it was just like, oh my God, like he went south, like he went bad, like he wasn't like that anymore. And then we did this spot, and then it's like, okay, we're getting it back. Like we could play peekaboo with him a little bit. We could tickle him, and he's laughing again. And then just as quickly as we finished the sessions, everything would go away. And it was like, wow, like what's happening? Like I thought these are things that are supposed to stick. I communicated this to his biomed doctor, and he said, you know, just keep doing it. And it's very expensive. Yes. So we were like, okay, we'll give it a try. You know, let's buy our own chamber so we could possibly save more money that way. And it started helping him sleep wise, but you know, it just would never stick. It never sticks. So we started looking into further things like, okay, maybe he, you know, has Lyme disease, maybe he has other things. And ironically enough, before even biomedical, Dr. DeShore, your name came up first for me, like on me and my husband searching different things. And my gut was telling me we need to go to you first, but we didn't know that my son had Lyme disease at the time. So we were like, you know what, let's not go that route. Let's do biomedical first and see, address all his other issues. We were big on like chelation, things like that. And yeah, and long story, so we went to another doctor, another holistic doctor, who, if I'm not mistaken, was bioresonance. Okay. That we did that, and we've seen some improvements with that. We did, but it was never like, it never stuck. Things like you would make progress, but then it was like 5 steps forward and like 10 steps back. It was always like, great, he's making progress, but wait, no, now it's back to square one. And like with therapy, that's how it always was. It was always like, oh my God, look, he learned this and he learned it really fast. And oh my God, yes. But then the next time they would come back, it was like, no, they had to start from square one. And it was always like that. And now, since starting with you, he's kept everything. Everything he's kept, which is amazing. Sorry, go ahead.
No, that's fine. So what I wanted to say was, we have a little munchkin in the room with us, right? She's the one, you know, creating all the ruckus, right? Hey, little girl.
Daughter Liana, sorry.
She is so cute. No, absolutely not. No, that's fine. That's fine. I mean, you know, we have families listening in, so that's absolutely.
I'm trying to keep I can.
So you mentioned a couple things. One was about, you know, your husband, Grayson's dad, being supportive, being on board. So you did not have any kind of conflict when it came to, you know, going with biomedical or thinking that there is hope for treatment for autism, or, you know, wanting to try herbal, looking at Lyme disease and keeping an open mind. So you and your husband seemed to be on the same page. He was okay?
Yeah, we were, which was amazing. Actually, the only little bit of things that we were on separate pages in the very beginning when I was in denial. My husband knew, I knew in the back of my head that something was going on with my son, but I just kept being that optimistic person, like, no, I will get, he'll be fine, he's fine, you know. That was the only difference that me and my husband had. He was like, no, there's something wrong, let's do something. I was like, no, he's fine, just give him time. That was the only time that we were on separate pages. Other than that, as soon as I pulled that veil over my face, I was like, you know what, I need to stop being in denial, let's do this. Ever since then, we've been on the same page. We've both been like, avid looking, like everything you could possibly imagine, we've been on the same page. Every time he's seen something new or read something I did, we communicate, and we're fully on board. And the best part about it is that him and I both feel in our guts, our bodies and souls that our son will get better, especially seeing all the progress that he's made already in such a short amount of time. We're very optimistic, very hopeful too. So that's amazing. Amazing.
So on that, you know, on that note, can you tell us a little bit more about what progress? Actually, before that, some of the symptoms that you've mentioned are hair pulling, rages, anger. So it was almost like, you know, you were seeing a pandas flare type behaviors, which of course are also commonly seen in children who are labeled as autistic. it's, you know, it's very interesting because myself, when I went through, you know, my own journey, as you know, with my son, and it was very similar to what you went through in the beginning. You know, there's the diagnosis, and you're kind of asked that, okay, this is what it is. You have to learn to you have to learn to deal with it. And just like you, mother's intuition kicks in. I'm a big believer in mother's intuition because, you know, we can see the light behind those eyes, you know, behind the eyes where the child wants to be on his own, play on his own, you know, no social interaction, lacking motivation. So
Yeah.
those are the things you saw as well with Grayson.
Yes, yeah, I seen all of that, and especially with starting biomedical, that's when a lot of his like aggression kind of behavior started coming out, where he used to get mad a lot, and I'm like, that's not him. He was always a sweet, happy boy. Like that's not him. And I mean, yeah, just recently I see him coming like a little bit more, but that's because, you know, like I've talked to you about before, he had a little bit of a flare up since going on vacation.
Yeah.
But that has actually gotten a lot better. Surprisingly, that his aggression hasn't been there as much. It's still a lot of his crying and whining kind of thing. And he's regressed a little bit with his potty training. But I mean, so far that's it though, with his regression, you know, like thank God that's it. But all the good and all the progress that he's made has still been there, which is amazing.
So it's,
you know,
it's sticking. Yeah.
Exactly, which is nothing like we've never were able to experience that. We've never experienced that at all. It was always like I said, 5 steps forward and 10 steps back with him. So yeah.
Can you talk a little bit about when you started the BioNexus herbal protocol? And, you know, I just want to put this out there as well, that it doesn't necessarily have to be the BioNexus herbal protocol. The goal is using herbals as a viable option for treating any underlying medical conditions that children with autism may have. And not every child with autism has underlying medical conditions, but, you know, Cynthia, you read and you read up about Lyme disease, you read up about mold exposure and biological toxins, and that's what you wanted to explore because you felt that there may have been exposure. So that's something, right? So how long after you started the BioNexus herbal protocol did you start seeing improvements, and what were those improvements?
Oh man. Well, honestly, it seemed like it was right. The first thing we noticed was sleep. He slept. There were like no moments, like no day throughout the week where he would wake up. So let me back up a little bit. So before we started your herbal approach, he would wake up and be so full of energy. Like I'm talking like vocal stimming with his ease and ready for his day, jumping on the bed and being super full of energy, super excited at like 2-3 o'clock in the morning. And we're like, oh my goodness. And it was every single day. Me and my husband were pulling our hair because he would wake up our daughter too, and it would be chaos. And every night it would be the same thing. We would always like, all right, you know what, let's prepare for another bad night. Mm-hmm. And almost like, I feel like maybe within a few weeks of the first month or so, 2 months, his sleep, it was a thing of the past. He was sleeping. He was sleeping. I mean, it was amazing. We were like, should we jinx it? Like, let's not talk about it. Let's not say anything about it. Like, maybe it's a fluke, whatever. But to this day, he has still been sleeping amazingly. Sleeping sound. And I'm talking about soundly, like that true healing sleep. Mm-hmm. Like, he does not wake up crying. He does not wake up hyper and like wild and vocally stimming. I mean, there was even a point where when he would wake up, he would then get full of energy and start with his vocal stimming and flapping and stuff. And as of recently, he actually stopped that. Now when he wakes up, he's calm. He's just sitting down, drinking his charcoal water and just hanging out. Like he's no longer my alarm clock in the morning now. I'm like, oh, hold on. I got to get my daughter up. I got to get him ready for therapy. Like, let's go, which is amazing, which is huge for us. Like he's very, very hyperactive kid. So to see that go down was amazing. That was one of the biggest things, the earliest things early on, one of the first things that we've noticed with him. Other than that, his focus, his attention, his ability to sit down and actually retain information from therapy. That was the other, and things that he was catching onto that we tried for so long in therapy, like eating with a utensil. We struggled. We did OT session after OT session and all these therapy sessions, and they could not get him to use his hands. Like he just could not figure it out, I guess, the coordination, whatever, something wasn't there. And one day to the next, he got it. He was eating everything with a spoon, fork, everything, and being so careful too. Like he is so motivated by food, of course, like many autistics. And he would pick it up and he would like, no, not want to drop anything. The focus was amazing. He was looking at everything. And that happened literally, like I said, one day to the next, like maybe around the same time sleep started improving. Once sleep started improving, then that was the very next thing. He started eating on his own, which was amazing because having another daughter, having to feed two kids at the same time is not easy. God bless the mothers with twins, but and so it was a huge relief off my chest to finally I can sit him down. And I even I took him out of his high chair and I gave him a booster chair, which was something I never could think of because he would either run up, get up, move around and not be able to eat. So now he's sitting like a big boy in his booster chair, eating his food. And then when he's done, he gauges his cup too, which is huge. Like he'll pick up his cup, drinks them. And when he's done, he'll put it down. And when he wants more, he'll get it, which is like, I know it sounds little, but for us, those are huge things. And in therapy, and literally it was almost like one thing after another. Sleep happened first, being able to eat with a utensil, his calmness, his focus happened, so he was able to finally learn from therapy. For the longest time, he did not play with anything. He didn't care about playing. He just wanted to either run around, flap and scream, or just sit on the couch by himself, even before all this. And now he's doing puzzles, something that I could never imagine him doing. For the first time ever, actually a few weeks ago, I bought him his first age-appropriate puzzle or toy, let alone just toy, because he never cared about it. And he can do every single one of his puzzles down to color coordinating and matching. And he's learning what a dog and a cow and I think a cookie is, which for a long time we'd be like, Kristen, give me the cookie or give me this or give me that. And it would just be like over his head and he wouldn't know. Now he can sit at the table and point to the cookie and give you the cookie. Or he's being able to potty train now. That's the other huge thing. So before it was like accident after accident after accident. And now we're up to an hour with no accidents. And because he's still nonverbal. That's the biggest thing we're struggling with currently. And he can't tell you when he has to go. So because of that, it's still kind of like a guessing game sometimes, you know? So, but if I really pay attention to him and I prompt him with his button to press the request pottying, then he will. But for now, I mean, there's days where I've even taken him to the park without a diaper. And I'm like, oh my God, this is amazing. Like, look at my 3-year-old being potty trained, which is great, you know? Like, so these are all things that I know they might seem small, but they're so big for us. Like having him be independent. Like now I take him to the store, I don't have him in the stroller anymore. I have him walking in the store like a big boy, holding my hand and walking with the therapist and having him pick out items on the shelf and put them in the cart. And just, he's being so good. He's being so good. We're, you know, among so many other things. I mean, he's still hyper. Coming back from Florida, like I said, he did have a flare up. So he is back to being a lot more vocal and saying ease a lot and flapping a lot and, you know, being very hyperactive. But other than that, I mean, his hair pulling went away. He's not hair pulling anymore. He has started biting, not biting, mouthing, almost like he likes the pressure with his mouth. And he's doing a lot of like deeper breathing, like almost like he's struggling to get a breath.
I see. Okay. So, sorry, I had to interrupt a little bit so I don't forget, but with the struggling to breathe, right? Shortness of breath, or it's called as air hunger. And that is one of the co-infections, Babesia, that causes, it's a co-infection of Lyme disease. Now, a flare, like you said, you know, when you came back from vacation, he was exposed to mold, and a flare can last anywhere from 2 weeks to 3 months. Yeah. Unfortunately. So you need to stay on your protocol. and I know that you and I went over what to do when there is a flare, additional strategies. So hopefully that will subside soon, and we'll actually discuss more at our next appointment as well.
Yeah.
So that right now, let's talk about his diet. Let's talk about his gut issues. What improvements have you seen with those?
I can't believe I forgot to mention that. I feel like there's so many good things that happen. I feel like I get jumbled up sometimes. I get so excited talking about it. But so before doing anything, or I should say before doing your approach and doing biomedical, that was always my big concern. He always had mushy poop. It was always like very mushy, a little bit thinner than mashed potato, but not very liquidy either. And I was like, what is going on? Like, why is it like we're doing all these things to supposedly quote unquote heal his gut? Like, why isn't anything working? And long story short, come to you, he's had formed poop. He's had formed poop. It's so formed. Like, I mean, there's times where he's on the potty and you actually like hear it. So sorry to be graphic, but like you hear it and it's so nice to hear it. Like, you know what I mean? Like it's formed. It's nice. His stomach used to be very distended all the time, like full of like air almost. Like sometimes I like palpate it and stuff like that. And I would just hear like the air in it. And that's gone. His stomach is no longer distended anymore. He's not gassy all the time. He used to be the biggest like farter. He used to fart all the time. He's no longer farting as much. His poops are formed and valid. He's not pooping all the time. He used to poop all the time. It was almost like every 4 or 5 times a day he would be pooping. Now he only poops like 2, maybe 3 times a day, depending on if we feed him a lot of things. Diet, that's been a huge thing. Before, I used to give him a lot of purees because that's one way that I could get a lot of the vegetables in him, right? So I give him a lot of purees with any kind of veggie, and then I gradually worked it up to a fine chop. I used to chop a lot of his stuff or like give him soup, right? And since him learning how to eat, I give him real food now. Like I give him steak, I give him chicken, I give him anything, like anything. I mean, he even likes kibasi, which that was like good because my husband's Polish and Irish, so he likes kibasi now. And I'm like, whoa, look at sausages and so many different things he's liking, and he's sitting there like a big boy eating away. And now we're actually getting to a point where he's able to kind of tell us like when he doesn't want something. Before, anything we used to put on his plate, he would just go for and eat it. Now he's like, I don't want that. Like, let me get something else. So we're trying to figure out like a little board for him to choose what he wants to eat, which is nice. You know, he actually has a little bit of a voice now. And like sardines, he's able to eat, and liver, the things that my father loves. That's my father loves. To show him these things and he loves them is amazing. So his diet has completely changed. With you putting us on the FODMAP diet, that's what decreased his bloating, changed his, gas, and has improved his gas, I should say. Okay. And yeah, he's been eating amazing. He's eating everything you could possibly think of. We're still a little bit like working on mashed potatoes and things like that. Sweet potato. He still doesn't really like that. He's more of a kind of meat and his fruit kind of guy, and his cereal. He loves his cereal, which is not really real cereal. It's like this kind of nut blend of like granola. Yeah. It's like, free organic. He doesn't have sugar in it, kind of thing. Like he loves that. Yeah, so he eats everything. It's like a thing of the past. Like even yesterday we were at a restaurant and I, of course, packed his lunch. And he's just sitting there on his chair eating like a big boy, eating away like a good little 3-year-old. I was like, oh, look at him being so good. Just
wonderful. I wasn't aware that your husband is Polish Irish. That's awesome. Like Dominican, Polish, Irish. Wonderful. No wonder Grayson likes his steak and potatoes, to be cliche, but anyway, just kidding, because my mom was Greek Irish as well, so you have a little bit of that. More of the Greek in me than of the Irish, but. So, these are really a lot of steps forward that, the progress that is sticking. You're not seeing these things go away. This is what he is now. It's become part of his personality. He's mature. He's only 3 years old. And we started, you started on the BioNexus protocol November, December last year, right? So you haven't been on the protocol that long either.
Yes, and we're still not at full doses of a lot of things. I mean, even the new herbs that you had just put us on, we're not even at full dose, not even halfway done with the herbal antibiotic that you gave for him. And I mean, we have a long way to go. So I could only imagine when he's at full dose of everything, what we have yet to see with him and all the progress. I mean, actually speaking about this before I forget, I wanted to mention this to you. So vocally, that's the one thing we struggle with the most, where he's very vocal, but there's no real sounds coming in. He's completely nonverbal. But you see him, he always tries. He tries and he babbles and he gets so like emotional when he tries, right? Yesterday we were playing outside after coming back from the beach, which he loved, by the way. He was in heaven, running and being his normal, happy self. He was amazing. But we came back and we were playing in the backyard and he cut his toe on a rock. And I was like, oh my God, Grayson. So I brought him inside and I tried to dress it for him. And he was actually saying, ow, which is sounds that he doesn't have the O sound or W. He doesn't have any of those sounds ever. Like he's E's and that, those are his sounds. So he was actually saying, ow, ow, and like pushing things, like kind of trying to push me away from like such. So, and instead of me saying like, oh my God, Gracie, no, it's okay, let me drive all this blood, I was just so happy. I'm like, look at you saying, ow. And that was just yesterday. So I'm like, oh God, I hope, speech is just right around the corner. I hope, But as long as he's making progress all the time, me and my husband are more than happy with everything. Even his therapist is so happy with everything. Like, and she says it herself, like he has so much in him. He has so much potential. And that she does believe that, he's in there. We just got to pull out all this information that he knows so much. And she thinks that he hears and understands a lot. It's just he doesn't know what to do with the information. It's almost like how she explains it. And it's like, it's so funny. It's so happy and relieving that somebody else, like outside of me and my husband and my parents, see it. Because you see him in there, and sometimes when you think he's not listening, he is. And he'll kind of look, and then he'll actually do what we're asking in a way. Because like we're like talking, but like almost not talking to him kind of thing. For example, like we're getting his dinner ready, like, oh, Grayson, your food's almost ready, let it cool off. And then you'll see him looking in the corner of his eye, and I'm like, all right, Grayson. And before we can even say, he's like, all right, come. And he walks and goes, like he's there, he's listening, he's understanding, And the therapist sees it too, which is amazing,
So that certainly is. It's yes, it is a process, and his verbal processing, his associations, all of those take time to fall in place in the brain. And now that he's calm, he's able to focus and concentrate a little more than he was able to before. And like you mentioned, he's not on the full antimicrobial protocol as well. So that is the next step for him to make progress with, to see where you're saying that his nonverbal communication has improved, his understanding. So do you speak English or do you speak any other language at home with him?
English, I speak English then, but like when my family's around, there's a lot of Spanish being spoken. But primarily when we're addressing him, it's always English.
And he seems to understand one-step commands, two-step commands. He's following.
That's one of the things that prior to seeing you, we worked on, and it was like nothing. Now he's like, Grayson, get this, give this to your sister, and he's able to do this, or give this to Nancy, which is his therapist, or give this to mommy, give this to daddy, and he's actually learning these things now, which is really nice, very nice. So yeah, he's getting there.
Does he have a minute to say hello?
Yeah, I can get him. I can see. Like, come on, buddy, you want to go get your brother? Yeah, she's saying no. Let's go get your brother. Let's see. Come on. Yeah, you want to come? No? Okay, she doesn't want to. Sorry, I'm coming down. Grayson! And that's one of the things. How he's listening. Sorry, Nancy, she just wants to say hi. Yeah, look. You want to say hi? You see how he like responded, came.
Yes.
And...
Hi, Grayson. Can you tell us a little bit about how he responds to his name? Does he recognize that you're mom, and does he still look tired? Can you explain a little bit more?
Yeah. So before coming to see you, he always had a very tired look. He had very deep eye bags. He was very pale, very like drawn, like almost like there was a bug sucking the life out of him, if you will. And now there's a brightness to him. His eye bags aren't so severe, like they used to be really dark black circles like around his eyes, to the point where my husband used to be like, he looks like he's sick. He looks like a sick kid with his big stomach, his drawn eyes, his paleness, his brittle hair. And now his hair is shiny. His hair's shiny, his skin has life to it, he's not bloated. He looks alive, like he looks like he's alive now. And before doing anything, it was like I would call his name, and it would be like I'm talking to a wall, like if no one's there. And now I call him and he responds. He knows almost exactly where to look to and what to do. And I say, come here, he comes, or give me a kiss. He gives me a kiss. I mean, when he's paying attention. Or I tell him, give me a high five, and he listens. Before, everything was like physical prompts, give me a high five, give me your face, let me give you a kiss. Grayson physically turning his body to look at the person. Now we don't have to do any of that. We just sit there and wait for him to actually pay attention and see what's happening. And so that's, his listening has definitely gotten better. It's not like talking to a wall. And he does recognize mommy. Every time I talk to him, he knows, he's like, oh, let me pay attention. It's almost like sometimes I feel bad because my husband's like, well, he's still not really listening to me. And I'm like, well, he listens to me. I was like, maybe he, just doesn't really want to. I'm like, I don't know. But he does listen to way more, like I said, than before. Before it was like talking to a wall, no one was there. And he listens to my husband too. Sometimes the therapist is a little bit work in progress, sometimes here and there. But like I said, it's been a huge improvement. Huge improvement. And he comes to me and he hugs me, and it's nice.
I can't thank you enough, Cynthia. This has been so wonderful that you were able to come on today and explain how your pretty short journey with BioNexus has been, pretty short journey with herbal protocols has been, right? We are dealing with Lyme disease, few co-infections, as you know, toxins, mold toxins. So it's a little bit of a work in progress, like you said, and maybe in the future we will revisit again with Grayson. Well, having a brief interview with me, that would be wonderful.
Oh, that would be amazing. Yes, super amazing. I could only imagine and hope. And I always knew, going back to my roots and going back to, herbs and natural things, that, this is what's going to be the thing to help my son, so I'm very happy to be here and talk about it. I could go on and on and on for hours about him. Like he still has a ways to go, but the progress, if anybody were to see Grayson then to what he is now, it's like a completely different kid. Like that's how the life was sucked out of him before, and how it's slowly creeping back into him now. It's like the best way I could describe it. It's like almost like a light is being shined on him, and he's finally coming out a little bit, like the best way I could describe it. And thanks to you, Dr. Deshore, thanks to you.
It's been my pleasure. It's been, again, absolutely amazing to see him blossom. And I look forward to him coming into himself even more. He's beginning to develop a personality. He's beginning to develop his own likes and dislikes, and he's beginning to be a little defiant now, right? He's not. So that's actually wonderful. That's good, and that's age appropriate for him to develop his own discretional,
yes,
so to speak.
Funny that you say that, because my husband always thinks that, maybe that's still part of his autism, where I'm like, I hear what he's saying, but there's still like a part of me where I'm like, he is only 3. He's still a little boy who, I'm like, a lot of the things that he's doing now is actually appropriate now. Like, yeah, he's getting a little bit mad when we tell him no, but isn't that normal? Like, like it's not so deemed a problem autistic behavior now. You know what I mean? Like, isn't this okay now? And that's a lot of things that me and my husband talk about, because my husband's still like, he still has his problems. Of course, I'm not blind, I see it, but a lot of it, I feel like, is he's just being a boy. He knows what he wants now. He doesn't want to eat something, so he'll tell you no. He'll like kind of cry and whine a little bit, or just kind of like he'll try to say no, and he'll like turn his head kind of thing. And I'm like, but this is nice. And now his sister used to bully him and just kind of take his things and do whatever. Now he's like fighting back almost, you know, like obviously you don't really want to see that in your kids fighting, but it's nice because I'm like, yes, Grayson, don't let her have that. Stand up for yourself a little bit, you know, like don't let her take your cookie. You eat your cookie, you know, like good job. And when I say cookie, it's like a sugar-free cookie that I make for them. I don't like it, but he loves it, which is great. But
and you've been really great with his diet. You're a good cook, and I'm sure everybody watching today must have learned so much. I think he needs you a little now, looks like. Oh,
it's past her nap time too.
Yeah,
so.
Yeah.
Okay, yeah, I hope I can have helped somebody, or have somebody come to you and help their child. And I tell everybody, my cousin right now is dealing with her son who's autistic too, and I keep trying to tell her to come to you and tell her about the progress that I've seen with Grayson, but not everybody's receptive. So if anything can be taken away from this, I just hope somebody comes to you and helps and tries to help their child, or see the potential in their child that
Yes.
I've only seen, I've only been with you for a few months and I've seen such great things. So
there's always hope. That's the biggest takeaway is to keep an open mind about different approaches. Herbal medicines definitely are a pretty strong, viable option. So, let me sign off now. Let me say thank you very much, Cyndi, for being with us today. And for everybody watching, thank you for joining us for this episode today. And I look forward to seeing you guys back here again on the next episode of Autism Uprooted with BioNexus Health. Thank you.
Thank you for joining Master Herbalist Dr. Jody A. Dashaw, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.